confirmation emails or text messages would be able to go out to them. We do that in Medesk automatically. So essentially you verify the consultation and everything gets sent out. So the patients will get exactly the information they need. However, if it turns out that they're not suitable for a telemedical appointment, or even on the other hand, if they've tried to book a physical consultation with you and actually they would be okay for a telemedical one, and you would actually want to push them the other way, then this process would work in the same way. And what you can do essentially is you can then provide the patient with an exact booking link for the service they want. So if, for example, they wanted a telemedical appointment at a certain time and date, but that time and date's not available for a physical booking and they need a physical appointment, then what you can do is send them an email with an exact booking link that will drop them on a calendar for that particular service, and it will make sure that they book that service physically at the right time and date in the right place with the right practitioner. And it will do all that in basically a single click. All the patient has to do is choose a time slot. And I would say that the time slot is dependent on actually what you've defined in advance. So you can make sure that you've got the right clinicians on hand at the time, make sure they're available and so on. So it means that you can make the most of any situation. So it means that you can get all the physical appointments necessary and all the telemedical ones necessary at the same time, without having them treated as completely separate pathways for the patient. So what I want to ask you is, how often at the moment are you finding that someone tries to book a telemedical appointment or tries to book a physical appointment, but actually they need or could be suitable for the other? Is it ever the case in your practice? Okay, so we've got one comment saying not really, it's all predetermined. Okay, fair enough. So when you say it's all predetermined, do you mean in terms of, so the screening that you would do would automatically then decide for the patient what's suitable? You wouldn't necessarily give them the choice. You would just go with whatever's more clinically relevant. Is that what you're saying? More clinically appropriate, I guess I should say. Yeah, that's fair enough. I mean, that makes a lot of sense. I mean, sometimes what I'm talking about really is, being as flexible as possible, but sometimes being as flexible as possible versus providing the best clinical care, they're not always the same thing. So it makes sense. I mean, what you do is you adapt it to your situation, of course. So Madeline here says, most times they're quite pleased to turn up physically. During lockdown, it was different. Lots of physical consultations. Yeah, so what I've found is essentially as well that during lockdown, people, either felt they didn't have much other choice or would, feel much safer doing a video consultation. Whereas now, people are, partly due to the length of the lockdown and, the fact that it's arguably less dangerous out there now. People are going to be turning up physically. But I suppose what I'm really getting at here is that if things do, go back to how they were a few months ago, if it does go in that direction,